my name is Charlie Louise and I'm a trainee practitioner. I love reading, psychology, travel and food, and I wanted to make this video today just to try and help people who might be struggling with getting through sort of this really difficult time with the coronavirus. I've seen lots of really awesome videos by YouTubers and influencers about who sort of just come from different kinds of backgrounds giving their tips, but I haven't really seen that much done by mental health practitioners or just healthcare professionals, so I thought it might be helpful to get that side of things as well. That being said, Russ Harris has done a really good one in line with acceptance and commitment sort of therapy principles, which if you're interested you can also check out. But yeah, I just wanted to, before we start, I just wanted to sort of let you know I am a trainee, so although I'm coming from a background with a bachelor's degree in psychology and working in the field of mental health for a few years now, I am not an expert and I don't know much about your specific case either, so please do sort of seek professional support if you need to, through contacting your GP or going through your local IAPS service to find out what might be the best avenue for you. But without any further ado, let's get stuck in. So the first tip that I have is just trying to avoid any health related news. And right now it can seem that it's really important for us to stay tuned to the news, find out about updates and really sort of be there 24/7 so that we can stay in contact with it and connection. And this can be really helpful for some people, but for a lot of others, it is something that only acts to contribute to maintaining their anxiety. I know for me, it's something that makes me feel really anxious when there isn't a sort of pandemic going on. And so I just make a note to try not to watch the news and to try and limit the amount of time I spend watching or reading it. So this is something that can really help people who notice that they might be feeling anxious, just as a way of trying to take a step back. So one way you can do that is by trying to allocate yourself a limited amount of time each day that you allow yourself to spend watching or reading about the news. And for some people you might find that even that is causing a little bit too much anxiety, and that's okay. So another step could be to take a complete news detox, to not look at it at all over the course of the next few weeks, and maybe just to ask a friend or family member who you trust if they could let you know if there's any developments and just let you know of anything that might be important for you to know. And I guess something that we're all really good at as well, and something this goes for too, is Googling any symptoms as well. So this is something that we're all guilty of. It's something that a lot of us do. And I'm sure you all know how it feels good temporarily until you read further down the list of what it could be. And then you feel that it's a really terrible thing and your anxiety grows. So if you have been someone who has been Googling your symptoms, and maybe you've got a headache or something like that, and you've just been Googling it during this time just to see if it is coronavirus, that could be helpful. But if you're noticing you're doing it every single day for anything that could be, that it's unlikely that it is, we're mostly all aware of those symptoms now, then I would really recommend trying to limit the amount of times you Google in a day, or just trying to restrain from doing that in general. If you do feel that you are likely to have a really serious medical condition, of course seek support and help, but just try and be mindful of if that's something that you're doing a lot and if that's causing your anxiety to go up rather than helping relieve it in the long run. And if you notice that rather than Googling symptoms, what you're doing more is just worrying more about things in the day, then it might be really helpful to try and limit the amount of time that you worry in a day to a time when it's convenient for you and a time when you've planned to do it. It sounds a little bit strange, and I'll go into a little bit more depth about this in one of my future videos I'm hoping to do, but that can be a really helpful technique, just giving yourself a set amount of time each day where you allow yourselves to worry, and then outside of that, not letting yourself think about those worries at all, and if they do pop up, just going, okay brain, thanks for that, and making a note of it so you can come back to it during that time. But like I said, I'll go into a little bit more depth about that in a future video I'm planning on. Number 2, practicing thought challenging. So if we do catch ourselves having lots of worrying thoughts, which is really common, or really difficult or unhelpful thoughts during this time, then it might be a thought like, if I cough then I definitely have COVID, or everyone I know will get COVID and die. And those thoughts can be really unhelpful, they're really common, and they're really normal in these situations to have. But if we are finding that we're engaging with them, spending a lot of time thinking about them, then thought challenging might be a helpful technique to help take away some of the power and anxiety associated with them. So ways that we can do that is through trying to see how that thought stacks up against the facts. So we can ask ourselves a few questions. There's lots of techniques and sort of worksheets you can go through on things like Get Self-Help, but we can ask ourselves first, is this fact, or is it likely to be more of an opinion that I have? What are the facts here? What do I know? What sort of do I know from what I've learned, the media, things like that? What are the facts in this situation? And could it be that I'm catastrophizing, thinking of the worst case scenario, rather than coming from a place of reason? So, for example, once we've gone through that, it's likely that we've discovered that it is perhaps more opinion biased, and we can start to think what would be a more balanced thought, what would be a thought that's more accurate of what's going on. For example, in one of the thought examples that we had above, it could be thinking, oh, okay, so I know it's unlikely that all of my friends and family will get it, and if they do, it's likely they'll make a full recovery, as that's what the statistics show. But what I can control as well is my own hand hygiene, and try and help support my family members to do that as well. So try and create a counter thought you can think when you notice yourself having those unworrying thoughts based on the facts and the research that you know. And that can be really helpful to remind your brain and to help self-soothe around that challenging and unhelpful thought that you might be having. So the third technique that I have is trying to practice mindfulness at some point in the day. And this is something that I reckon a lot of you are probably looking at and going, why would that be helpful? Right now, the last thing I want to do is to shut my eyes and to think, let my mind wander and think about the terrible things that might be happening. And that is a very common misconception of what mindfulness is. So what mindfulness aims to do is, instead of just closing our eyes and letting our mind wander, that wouldn't necessarily being present. What mindfulness is about trying to draw us into the present moment. Often we spend a lot of time, especially in these situations, thinking about what ifs, thinking about what could happen in the future. So what mindfulness aims to do is make us more comfortable with those thoughts that we might be having, and trying to help us come more aware of them, helping us to have a better relationship with them, so learning that they come and they go. Some might be stickier than others, but they do go away at some point. And it also helps us to be able to focus more on the present, rather than getting caught up in those thoughts that might be happening, and be able to being really in the moment, I suppose. So in times like this, all we can really control is our actions and what we do. So mindfulness can be a really powerful way of helping us to feel like we have some more control in the situation. So mindfulness can really be anything. It doesn't have to be sitting down and doing a breathing exercise. That's really helpful, a really good form of mindfulness, but it's not for everyone. There are other techniques, more physical ones, like progressive muscle relaxation, which is some people prefer. There's grounding exercises, which try and get you to focus more on the senses, bring you into the moment that way. And then there's just the simple day-to-day mindfulness tasks, which will have a really good effect as well. Maybe not as strong as those more formal practices, but they'll still have a really good impact. So it could be so for example, if when we're doing the washing up, we notice our mind speeding away with thinking about things that could happen, or when we're watching TV, we notice that on our phone at the same time, scrolling for updates, it could be that we take those moments to try and be mindful and present by, instead of watching the TV with our phone, putting our phone to one side and just trying to bring ourselves back to the TV programme, looking at the characters, what are they like, what are their voices like, do I like their voices? Just trying to bring ourselves back in there. What's our posture like? What is the smell like in the room? Or if we're washing the dishes, trying to focus on that sensation of moving in the bubbles, the smell of the washing up liquid, all of those kinds of things. Just trying to bring ourselves back into the present, and that will have a really powerful effect as well. And if you would like any support with doing exercises, it can be really helpful to do one that's guided. Headspace, Calm, YouTube, all of those are really great resources with a mixture of free and paid content that can be really helpful with doing some of these with them. I was thinking of doing some videos as well with different exercises on, so let me know if that's something that you would find helpful. But yeah, mindfulness is really whatever way that you can to try and just be present in the moment and not caught up in thoughts. Like I say, you can be mindful watching TV, and that will be a good thing. So the fourth tip that I have is trying to make sure you're getting your daily exercise and daily outdoor time. So this is making sure you're taking time to get out each day or taking time to do some form of physical activity. It doesn't have to be anything major. It doesn't have to be cycling a lot. It could just be going for a walk around the apartment or around your around the neighbourhood. Just making sure you're doing all of this, of course, in a safe way. So a change of scenery can make a massive help with. A change of scenery can have a massive impact on our well-being. And there is a lot of research to support that spending time in nature can make a really big impact as well on how we're feeling and our well-being. And it's something that a lot of charities and things are picking up on and running support programs to help with. So if there's any way that you can get out in nature, then try and do that and incorporate that into your day-to-day. And we know as well about any kind of physical activity, there's a lot of research to support that side of things. It could be just trying to walk vigorously, it could be doing yoga, it could just be trying to do some stretches, or if we've been sitting down for a while, just getting up and going and moving over to do the dishes or moving to put some washing away. All of that will help us to feel less static, less low, just getting moving in whatever way feels comfortable and manageable for us. So the reason behind that is because any sort of movement, especially where we might get our heart going a little bit, helps with releasing feel-good endorphins. And this is something that's actually recommended in the National Institute of Clinical Excellence for their guidelines for helping to manage depression. So what they recommend is 30 minutes of some kind of exercise a day that just gets the heart going just a tiny bit. So that could even be a vigorous walk. And that will have a significant impact on your mood. Research has found it can be as effective as taking antidepressants for mild to moderate depression, just showing how impactful doing some kind of exercise daily can be. Like I said, that could be a walk, it could be going for a run, it could be trying to join into a YouTube yoga video, or even Joe Wick's Facebook live stream at 9 AM PE lessons, which I definitely can't do a whole one of, but it could be a fun way just to get some 15 minutes in. And doing that twice a day, 2 15-minute slots, that's your 30 minutes there. That's going to have an impact. So my fifth tip is just trying to get some sense of connection each day with someone else. And now more than ever, it's so important. As we're all practicing social distancing, this is something that can really drop off our radar, something that we might end up going days without speaking with anyone or connecting with anyone, or even just going a while with just speaking to the people in our house and not necessarily connecting with anyone else, both of which can have a detrimental impact. So just trying to, speaking to others in our house, of course, is a good thing and is of course going to help with our mood, but over time it could be that drawing on other people is really important too. So each day try to give someone a phone call, a video call, send a letter to a neighbour, pop a text to someone at the very least. Just try and connect with someone else in whatever way that you can. I've got pins and needles, I'm sitting on the bed. So just try and connect with anyone however you can. Maybe it's joining in to do a workout together. I'm doing that with my friend later. Or my family we're starting to do like a family quiz night once a week over Zoom. So that can be a really great way to get some kind of connection in as well, just trying to be creative with what we've got. But that's not going to be possible for everyone. And if you are one of those people who's really struggling and doesn't know who they could turn to or doesn't have anyone they feel they could reach out to, then it could be trying to join in with social contact in other ways. So lots of companies are doing daily sort of live streams, videos, classes, gym classes, all of that kind of thing. That could be a really great way for you to make some kind of connection with other people. For example, my yoga place is doing online classes. I did one of those yesterday. It was really nice just to hear other people's voices and just to have a bit of a chat before the class. Just find a way that you can try and do that. If you feel that there wouldn't be anyone that you could turn to or that isn't for you, and you feel that you would really need some support in the meantime, then you may find one of the helplines really helpful to contact. There's Silverline, which is one specifically for elder people, or there is Samaritans, which is a great free listening service available 24 hours a day, 7 days a week. Their number in the UK is 116123, but do have a Google for your local service around that. They're quite widespread and they can be a really great thing for people to contact. So please don't, please try and get some kind of social contact in your day, however you can. Number six, with the T is the extra digit. Try and keep up your self-care needs. This is something that can really fall off our radar now that we're no longer having to go out as much. We may not be having to go up to work, or we might be working even longer shifts because of the circumstances. Our self-care can really fall off our radar, and it's something as well that I think a lot of people have the misconception that what it means is doing things like having a bath or going out and doing crocheting or some hobbies or something, and you're like, I don't see the point in that or the value. And I would say that's a big misconception of what self-care is. All self-care really means is doing the things that we feel we need to do to stay healthy and to stay well. And for some people, it might be that having that bath is their way of sort of relaxing, and that's really important for maintaining their mental well-being. But for others, self-care could be just making sure they're taking their medication as prescribed, or going and attending their hospital appointments, things like that. What everyone can try and remember to do to look after their own self-care is making sure they're staying hydrated, trying to make sure they're eating enough in their day, getting some kind of routine however you can, trying to keep your immediate environment quite tidy, and even if that's just 10 minutes a day of trying to tidy up. Now that we're staying inside more than ever, things get cluttered really easily. Taking the time to do a bit of a declutter. Just trying to think of any way that you can make yourself feel comfortable where you are. It's finding a space to be able to do sort of your hobby or your work, that's its own kind of self-care too. Maybe if now seems like now is a really good time to start new habits or to break a habit, so try and incorporate that into your self-care. Finding a space where you can do a hobby. All of those things are really important with looking after our well-being and trying to help with reducing our anxiety and feelings of low mood. Mind has a really good resource on this. I'll put the link in the description, but that could be a really good thing to look onto if you wanted any more tips and tricks on how to help look after your self-care in these times. And my final tip, number 7. So for this one, I don't know why I chose 7, but that's the number I chose. Maybe Harry Potter influence, who knows. So anyway, number 7 is be kind to yourself. And this is something that this is something that is more important now than ever before. It's something that we're likely not really good at, especially now that we're being with ourselves perhaps a lot more than we would normally. And now for some people seems to be a really good time for them. They might be seeming to do a lot more, and for others it's really not the reality. We're not doing as many things as we want to, and that is okay. Now is a really anxious time. It's unprecedented times. We're in a period of time where in future generations this is going to be in their history books, and that's really weird. So it's completely understandable if right now things are really hard, if you're struggling to get out of bed, or if you're struggling to do things you would normally do, lacking concentration, lacking motivation. All of those things are okay. It's so important to be kind to ourselves and to celebrate what we are able. Hello Siri. It's really important. It's really important to just try and be able to celebrate what we are able to do. Pat ourselves on the back for anything that we manage to do. So that is really important, whether it's just getting up and being able to brush our teeth before watching YouTube videos. If that's something we didn't do the day before, celebrate it, or just celebrate that you managed that if you're really struggling. Something that can help with our motivation is just trying to think something that can help with our motivation is something that our brain really likes, and that's having a goal, especially a goal that is in line with maybe what's important to us or our values. So it doesn't have to be a big goal, but just trying to plan something that you want to get done each day and making that your goal of the day. It could be something as simple as just wanting to take the bins out. That's my goal for the day today. I keep putting it off. Or it could be something a little bit part of a bigger project. It could be breaking that big project down into smaller chunks and just doing a little step each day. to reach an overall goal, which is another really great way of helping with motivation. But alternatively, if you are just finding it really hard to get up in the day, that's okay, that's understandable. It could just be thinking of things in a different way. If we're thinking of the whole day looming over us, that feels really overwhelming, then instead of thinking about it that way, just try and think, okay, well, what's the next thing that I can do? Just one little step I can take to help me maybe feel better, or to help me work towards being able to do this. And if you're stuck in bed, that could just be pulling back the cover and sitting up. That's step one. If we're able to do that, that's great. Next, standing up. Okay, I've done that. Right, well done. Let's make it to the bathroom. And so on. Really breaking it down into those minute, 30-second chunks is a really great way of finding that motivation to get up or to get started with something. And give yourself credit for doing that. That's really great. So, in sum, here are sort of a few questions that you can ask yourself each day just to try and make sure you're getting those 7 things into your day. So, number 1, how am I feeling today? Just check in with yourself. Ask how you're feeling. How am I feeling today? How am I getting outside today? How am I moving my body today? Who am I checking in on or connecting with today? How and when can I stay present in the day today? And finally, how can I meet my self-care needs today? Alright, thanks for staying and watching to the end. I hope you've enjoyed it. If you have any comments or anything like that, anything you would like me to write about or talk about, please do post in the comments below and stay kind. Thanks, bye!